Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. Second chances.
Yes, second chances.
That's what the story is about.
It is. Can a great PA have a messy past?
The answer. We think yes, but we're going to go over it.
Yeah, I think that if you want longevity in this field, you can't expect perfection. Personally.
You can't expect perfection for any person, any human, in any aspect of life. So and we're no different.
If there's a blip, if there's a smudge on your record, not like criminal record, but like personal record, professional record, is that now your scarlet letter?
Yeah.
Like, will we ever move on and forget? Do we get a second chance, or is this just your defining thing?
Yeah.
It's like crying at work. Are you the crier? Like, this just defines you forever.
Well, first, how was your week?
My week was good. The last 24 hours have been a lot. But no, my week was good. Clinic was good. I trained another PA this week, so I had my teaching hat on, so that was good. That PA had to go home early and said, that was a lot, but I will be back next time. So
okay, that
was good. Yeah. So a lot of communication stuff this week. I did a review for another PA this week. My patients, I had a really good patient interaction this week where, again, we see this all the time. She's having severe shoulder pain. She's been diagnosed with frozen shoulder. It's not frozen shoulder. It is secondary to whatever.
Something else going on.
The MRI that she got, she has this massive cyst like front of her shoulder. And it's one of those things like, she's like, it hurts right here. And the radiologist mentioned nothing about it.
Yeah. And you're like, well, it could be.
No, so I aspirated it and she wrote me this patient case. She was like, that was it. Like,
doesn't that make you feel so good? You're
it does, but then I thought it was going to be a nice, easy exchange.
Yeah.
It's like, thank you so much. And I'm like, you're welcome. And she wrote back, she was like, why in healthcare does a radiologist not see that? And why did you see that? Are you a radiologist? I was like, no, but like,
I'm just better than that.
No, but it was, it led to like a 26 back and forth situation. You know what I mean?
Yeah.
But no, I had good patient interactions this week. All my notes are done. So that's good.
Congrats.
I'm interviewing a couple medical assistants next week. So that'll be, yeah, we'll see about that.
Yeah.
So life is transitioning and I'm here for it.
Yes.
So, a lot of other personal trials and tribulations that will occur next week as well.
Yes.
So we'll see. What about you? How was your week?
It was good. I think I'm just trying to, sometimes like things just get a lot and overwhelming and you just have to step back and say like, I'm just going to focus on getting it done and doing the best that I can with what I have available to me.
Did you get it done?
Last week, yeah. I mean, we semi-crushed last week. I just had, I don't know if it's a summer thing, a lot of no-shows in my schedule, like 5 to 10 a day. It's kind of crazy. It's a lot.
Yeah.
A lot of it is like urgent care follow-ups that just don't show up. But so that, there's some other like administrative things going on that have affected my schedule. And so just not as full as usual, but we did 21 surgeries last week.
That's insane.
So that was a lot. That was pretty good. And it didn't even feel like I feel like were we like
that's insane.
Shook by it.
Yeah.
It just happened and it was good.
That's
so
good.
I like that. But yeah, overall good. And, gonna make next week exactly the same, even better.
Yeah.
Yeah.
We're down a day next week. That Friday clinic, which affects you.
Yeah, that's my big clinic day. Yeah. So like our volume is going to be lower next week. Our surgical volume is lower next week too, because there's another day that we're closed. So it affects a lot of things.
Yeah.
I had a negative patient review this week, but not to go off on a tangent, but on the opposite ends, we always talk about the negative reviews. So like, why do we get that? Like so unfair. What about the ones that you get that you're like, that's justified? Like,
oh, when the patient's right.
Yeah. When they're right. Yeah. Yeah.
Was this the one that you said you had to leave and come back and leave and come back?
Yeah.
Did they like?
They came back to haunt me. I thought enough time had passed that like they just didn't get the review thing to fill out because it's randomized. But of course,
I got it. No, I'm saying.
Like they got it. Yeah, of course they would.
But let's listen. It doesn't go to everybody, but it went to that person.
It went to that person. Of course it did. And you know, those ones, like, they don't upset me as much. Like, they upset me for myself because I'm like, do better, Hannah.
Yeah.
But yeah, like, I look at it and I'm like,
but it also highlights what's wrong with the system. Like,
it does.
You can't be a high volume provider. Like, if you are a high volume provider, when you're a high volume provider, if you don't have endless resources, like you don't have endless rooms, injections aren't drawn up for you. There's like an available ultrasound every time you need one.
Yeah.
If there was, you would be on time all the time.
Yeah. Like, if the system, there are some system constraints to it. And some of it is pure, just like, sometimes there's human error and things too. Like, I legitimately, in that scenario, was like, I had a young child who was like screaming and inconsolable, and you know, we had to do this cast thing with them, and they were going freaking crazy. And in dealing with that, like, mentally, that was all that was on my mind. And you know,
as it should have been.
And you know, I also recognize that we don't live in a world where people can sometimes just recognize, like, oh, things like that happen. Like, clearly they weren't intentionally trying to they think you were intentionally trying to wrong them. Yeah. Instead of being like, oh, like, they're clearly very busy and things happen, but you know, whatever. I don't have that expectation of it, but otherwise, very good week. And next week I will not do that.
Well, now, but if nothing else, though, like, those crappy reviews make you self-aware.
Yeah.
You know, especially when you're like, the patient was right. Like, I get it. And you know what? If that were me, I might have also said something. Maybe not like publicly in a review platform.
Yeah.
But maybe next time I would have been like, hey.
Yeah. And I know. And that's the thing too. Like, I talked to them after and I apologized to them in person. I'm like, why'd you feel the need to like do that? But whatever.
Yeah.
It was easier for them. So
yeah.
But going into the Scarlet letter.
Yeah. So the topic for today, I am going through application after application of new providers. And I've had, not just recently, but like over the past 10 years, various applicants that have like small red flags and then some that have big red flags. Some that would have things I wouldn't consider a red flag, but like those that I have to get permission from say that they are. So, the question of the week or the day, whatever you guys want to do here, is, can you do something wrong professionally, personally in your past? And does that now define you going forward?
I mean, from a moral standpoint, I like to say no. I think that, yes, you will always, you know, have that experience or carry that with you in some way, shape, or form. But should it prevent you from being able to move on? I think no. Well,
again, healthcare, I mean, you're a person, I'm a person. We are people that decided to go to PA school and we learned all the things, but like, we're also humans, you know? So we do things that sometimes are dumb, not professionally necessarily, but sometimes in our lives. And you have to separate the professional person entity when they put on their white coat or scrubs or whatever. They hold a certain standard expectation, but then like you get to take that off.
Yeah.
You get to take it off when you go home.
Human at some point in your life. And so like you have to be given the grace that like, this is my job and this is my workplace self. But like outside of that, I'm still just the same.
But like, what if it's not? What if you go to the grocery store and you like, I don't know.
Well, you do go to the grocery store and get curbsided.
I do get curbsided. And like, what if I get cut off and I want to flick somebody off? Then guess what? They're my patient. Like, I mean, I think about that stuff. You know what I mean? But like,
and you do.
Yeah.
I will tie this is a weird way to tie it in, but like I was in a sorority in college and looking back, I mean, like these are silly things, but in the grand scheme of it, I mean, this is a big life lesson. One of the ways that the sorority board would explain to us every year, like how you conduct yourself, you're a representation of this organization and the bigger picture. So like, yes, everybody's going to party in college and have fun and like do things, but recognize that like other people who aren't in organizations or this organization, they can do whatever they want and look foolish, and that's on them. Now, if you do that thing, it's not only on you, it's on us too. Like you are representing us wherever you go. And so you are part of something bigger than just yourself. And it's a privilege, but it's also a responsibility.
Yeah.
So I do think that there is responsibility with certain careers that maybe others don't have. Like if I worked at Target, I don't think Target cares what I do on the weekend.
Yeah.
Arguably,
but
I
like,
don't think he or she care what I do on the weekend either,
no.
but you know.
But I think like you're held to a certain standard because you have to be there for your patients.
Yeah.
I get that. But like it is impossible to be on, quote, on 24/7 all the time, which is why you don't have a job where you work 7 days a week. Like there are some days where you just unplug, take off, whatever. And again, like that doesn't mean that now all patients' needs like don't happen for the days that I feel like I'm not going to do that. It's signing out to somebody else. Or like, you know, if I'm not reachable, this is why, and this is who you can reach. But I don't know. I struggle with trying to represent who I am for all my patients and the practice, but also like, I don't want to go to a soccer tournament with my kids and one of the moms is like, hey, can you check out my knee? Which by the way happens all the time.
No,
so like, I'm not working now. Like of course I'm not going to then make an enemy and say, absolutely not. Here are my business hours. But like for the things where we judge people, what about if everybody wants to get drinks, right?
Yeah.
And then I'm the provider and I'm the provider who treated that person's kid. Yeah. Like now I have to think like, okay, can I socially have a drink without that parent thinking that I'm going to drink and also treat their patient? Like, you know
you should
like,
be able to. Like people have to be able to separate in their minds. Like this is your non-workplace self. Like this doesn't mean that I get drunk before that I pour some Baileys in my coffee before OR days. Yeah.
But also like, you know, if I am in an adult soccer game and I rage out on someone on the other team, then next thing I know, I'm seeing them for knee pain. Like what?
And they're like, wait, didn't you cuss me out? Like, didn't you actually trip me?
But like that's
like I did, and now I will help you.
Now I will help you. But that's the thing. Like, I mean, we have to be held to a certain standard, but also like we are human. So in professional PA career, like when is it a mistake and when is it a pattern, right? Like that's something that I would say when you did something one time versus this is what you do all the time, right? Yeah. So that's something to consider, you know, what is normal behavior, what's not.
And also like, does it affect your work and your job?
Like, is there a professional repercussion for what you're doing? And this is a choice you made professionally, or this is a choice you made personally? Yeah. Like if I want to go hold up a picket sign and riot against, I don't know, PETA, whatever. Can I do that if I'm wearing like my weekend clothes? You know what I mean?
I would think yes. Like, are you not allowed to have opinions and things as a provider?
But with that being said, I should be ready to be held accountable for questions with that. Should I be punished? No, but held accountable for that, I guess. But also, like, I don't invite into the patient room people's opinions about my personal life. You know what I mean? Yeah. Like, I'm there to treat them, you know, professionally. I don't need them to give me opinions about my life personally. Yeah. So it's hard. It's a really hard line. And when you live and treat in the community when you live in the community you treat in, how do you avoid it?
You can't really, especially like, and it's like a big community, but it's also a very small town. Yeah. Still, like you will see them at the grocery store and at the local watering holes.
You will see them at the watering holes. But here's the thing: we live in a world where your public image affects how people think your competency level is.
So then let's dive into like social media stuff because like this is big, and you know, there's a lot of providers representing themselves on social media. Yes. These days.
Okay. So when I was hired, all you had was the old resume, references. You call the references, maybe you don't, I don't know. And then maybe like hearsay, like, oh, let me talk to you who your supervising, you know, physician was for your rotations. That's it. Now, and I'm guilty of it, you can Facebook stalk people. Yeah. You can Google search them. You can look at their Instagram. Yeah. Like now you look at all facets of their lives. Yeah. Do I do that to see how good of a provider they are? No. But I do that. But I also do that to see like what package they're bringing to the practice. Yeah, like you said, like
who are you as a person?
Yeah. But they represent your practice. So if you've got, I don't know, so judgy. But if you've got someone who like is such a political social media presence. Yeah. One, I guess, and I'm not saying like, you know, I'm going to judge that and say, oh my God, I can't have that. But like on the interview, hey, I see that you're very active socially in this regard. How do you draw the line when you're at work?
Are you going to bring that here?
Are you going to bring that here? Yeah. Or, you have certain feelings about, I don't know, anything.
Yeah. Yeah. Any of your personal views, are you going to bring that in? And if no, I don't think that's an issue.
For example, our PTs, a lot of them give the parents their cell phone number, right?
Yeah.
Because we have a lot of student athletes that our PTs treat.
Mm-hmm.
So to communicate, the PTs don't communicate directly with the kids because that's weird.
Yeah.
You give the parent your number, right? So the parent now has your number. Now now their algorithm like populates you, whatever. We had a PT that was a bodybuilder and all she had was pictures of her posted in like bikinis. It's like a little uncomfortable.
Yeah. Yeah.
So like, are you getting more patients because you're a legit PT? Or are you getting more patients because they like looking at your pictures?
Yeah. And I mean, that's sad stuff to think about too, because like my defense for this person, and again, because so like I participate in social media. I post pictures of myself at the gym very frequently. Again, like that's my personal life.
But you also don't have an account that says Hannah, the ortho PA.
Well, it does.
No. Okay, hold on. Okay. No, but I'm sorry. All identifying factors.
Yes.
Right, you know
like it's not about, so my social media account is not about my profession.
Yes.
It's my personal social media account. Do we have and by we, I mean like my team and my doc, do we have a somewhat professional social media account as well? Yes. But that one is purely like work related things. But I do think like, if you're going to have a personal account where you post those things, great. Obviously I wouldn't advertise myself with those things on it. Like put bikini pictures on a professional account.
Yeah.
But like, I don't know, like that's a hobby and a sport in itself, right? Like what if you're a CrossFit competitor and you wear like, I love those short CrossFit shorts. Like what
but it's confusing though, because the social media accounts that promote professional, networking like LinkedIn, that's a platform that it's advertising like, yes, post. And then you have to take that, shift it, and then your personal stuff. Yeah. So like, it's like you put on a hat of professionalism and this is my professional profile. And then here's my non-professional profile. And God forbid someone sees that they are linked. Yeah. And now it's confusing for them.
Yeah. But also I think, and again, going back to the like, even though you have your personal life, it does come back and represent the greater picture of your company or your organization. I think you should be able to post some things that are personal and fun and like you living your normal life within reason. Like, am I going to post a picture of myself in a bikini? What is that called? The beer funnel?
Yeah.
Doing a beer funnel.
Yeah.
Yeah.
Probably not.
Yeah. Like, I don't think that's a great choice. Should I get fired over it if it was posted? Probably not. But like, should you be posting it? Also, no. Like, I wouldn't be surprised if I got a stern talking to, like, hey,
maybe you
don't
shouldn't do that. Yeah.
Is it a fireable offense? I don't know. Maybe if you continue to do it after being told not to, or maybe you make your account private and make sure that nobody can see it except your personal
what's
friends.
Crazy though is what if you have a patient that happens to see or hear whatever, and they, decide that you are, I don't know, you're Catholic, and they can't see you anymore because they had no idea you had such strong religious beliefs or politically.
Yeah. I was thinking politically too. Like that's such a big thing. And for me, not everybody feels that way, but it just blows my mind that like you can't have differing opinions and still like be friends with somebody or have them treat you professionally and it just be out of the picture of like, what you care about. But I know for a fact that it does affect things, and I'm guilty of this. Do you ever find yourself like, I mean, I never discuss like political things with anybody, but you shape shift a little bit when you talk to patients. Like, is your personality a little bit different in the room if Joe the farmer comes in and you're like, oh yeah, like the goats.
Well, totally. Totally. Talk about farming and sweet potatoes and I don't even know what.
The tennis mom.
Yeah.
And you're like, oh my God, listen, like I totally get it.
Yeah,
and my voice, I become Valley Girl. I'm Valley Girl in those conversations.
Well, no, I think you are trying to be relatable, because if I were to see a healthcare professional that was not relatable, I'm not going to disclose to them things that I maybe should. I don't know. Yeah. And I'm not looking to be their best friend, but if I saw my provider as perfect human, doesn't make any mistakes, I would have trouble relating to them. Or let's say, hey, did you do your home exercises? And I see the perfect person looking at me. I'd be like, yes, I did.
Yeah.
I did.
Yeah.
But I don't want to disappoint them and tell them I didn't, because they
would have.
They would be disappointed because they're so perfect.
Yeah.
Like,
of course you would do your home exercises.
Right, exactly. But I don't know. I feel like it's so tricky, the professional persona and then the personal persona, and keeping them separate. And people get very confused between the two of them. Yeah. And we are guilty of that.
Yeah.
We're guilty of that. So,
question then, would you rather, if you're interviewing or hire somebody who's a great PA, but they're all over social media and they like post a lot of stuff, or somebody who's maybe like not as great professionally, but they're not on social media and you have nothing to judge them based off of?
I would rather hire A, because I would think B would be a murderer.
Yeah.
Right?
Yeah. Like, why don't you have social media? Why don't you have social media? It's 2026.
But also the relatability factor. Yeah. Like, how are you going to be relatable if you have no social identity? I don't know.
You might get pushback.
But again, would I not? I know. But like, would I exclude that person? I don't think so. It's just a very weird world that we live in, because it's not so black and white, and nothing's like, this is paper and this is perfect and this is not. I mean, I don't know if someone does. My husband doesn't have social media and he's not a murderer. I mean, I don't think so.
I don't know. You've told me a story about, I don't know. What's his name again?
Who?
The snake.
Mookie.
R.I.P.
R.I.P.
Oh,
Mookie.
God. But so maybe.
Anyway,
we don't know.
So from a, peer-to-peer standpoint with social media, we judge.
Yeah.
For better or for worse. Yeah. Patience, I think
they do.
They judge, right?
Yeah. Hardcore. So
let's talk about like hiring. Okay. So when we hire someone, and I'll give you 3 very distinct scenarios. We hire someone, I'm looking at where they went to school, where they previously worked at, very searchable, professionally searchable, and Google the crap out of them. What I'm not looking at is the stuff that I have to work for. Like, I'm not looking at criminal record for John Doe, right?
Yeah.
But my background check does. And that's not my job, but HR will do a background check. So scenario 1, years ago, I hired someone that had experience in ortho. A resume was solid, had worked for at least 5 years. She interviewed great, asked really good questions. Background check came back, and there was this misdemeanor. I'm using like very soft words for something about leaving a kid in a car. Okay.
I don't laugh because that's acceptable. But
but like, I don't even know what it is. Like, it's a misdemeanor, and it comes up on a background check. So then I get the question from HR, hey, this came up. Do you want to proceed? And I'm like, okay, are you asking me if they're going to leave patients in a car?
Or in the room like I did last week?
Or like Hannah's guilty, right? So like, that is something that came up. Who knows how many years ago it was. Now it's uncomfortable territory where now I have to talk about it with the person. So I did. And I felt like I was violating something. I don't know, because I don't care, if we're being totally honest.
Yeah.
And she gave a story about what happened, how many years ago it was. And her mom was watching the kid and it wasn't her. And she was actually working 3 jobs. And long story short, she was guilty of what they said.
So here's my thought with this too. Nobody who I'm sure 99% of people who leave their child in a car, it was a major accident, and I'm sure they feel worse about it than anybody who is judging them from the outside, and they're like, didn't mean to do it.
But can you imagine that? Like, one, were they even in healthcare at the time?
Yeah.
Okay. So what if they were 19? And what if 5 years later they went to school and they changed their life around? This now follows them, so that on a stupid interview for an orthopedic practice, I'm asking this person, like, who am I?
Yeah. But also, like, that's basically saying that somebody who works in a certain job can't make a simple human mistake. I'm not saying that's a little mistake, but like, you can still, like, anybody can have a long day, probably
But here's the thing, okay? Like, that is traceable. That's a legal thing. What about the town idiot that goes to the bar every Friday and gets hammered? And I have stories about that person. They apply for the job. There's nothing
But
traceable.
It's not like
this
they never
is just
got a
hearsay.
DUI or
No,
anything.
no.
Yeah.
So now on paper, based on our stupid standards, that person
Is better. Better fit.
Better fit. Yeah. So like that, the background check dilemma. So when you now know, now we have to address scenario number 2. We had a provider that we had interviewed years ago, and this person had a very heavy presence in the LGBTQ world.
Yeah.
Professionally.
Professionally.
They were they were the face of this professionally.
Yeah.
And everything.
Like had a social media account, like
social media account,
like living in this space as a provider, basically.
Yes. Yeah. And felt very, 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 very strong with we should make a movement in healthcare to get rid of pronouns altogether, like very much place their thoughts. And again, substitute this for religion, politics, everywhere, but very much professionally driven.
Yeah.
So did this come forward in the interview? No. Did I find this when I researched a person? Yes. So now having that person represent our company, now this lumps all that together. So now that is the face of us as a company feeling a certain way.
Yeah. Like you're basically deciding that you're going to make a stance, and nothing, if that's the right or the wrong stance, but like you now
own it. You now own it. So I had addressed it with this person, and this person was like, listen, this has nothing to do with this job. I don't even know why you're asking me. I was like, but it does though, because your identity is very much intertwined in what you're doing here. And I'm not saying I don't care about it, but like, how do you separate that from your professional job? And they were like, I don't. And I was like,
yeah.
But I mean, who am I to say, well, I need you when you put on your coat to feel a certain way, do a certain thing. It's not what I was saying, but it's just,
you can still be yourself, but
it's like coming into work with like a Trump hat on every day.
Yeah.
Like I'm going to ask when you're here to maybe not put that hat on. And as soon as you leave, wear your hat. It's not saying that I don't support you. I just don't think you should bring that to a place where now you're being very forward with what you do and don't support.
And this is like because of a patient thing.
Yeah.
Like you are working in a role where you have to be neutrally serving all people, regardless of how they feel about what. And I'm not saying that, like, I think it's wrong for patients to judge their provider based on how they see them, but it is going to happen.
Yeah.
And, you want to make everybody comfortable to an extent. Like if you're treating somebody who sees that you're wearing the Trump hat or whatever, and they don't feel that way, well, they're now uncomfortable seeing you. Is that right? Is it wrong? I don't know.
But it's also addressing what is real. People, whether they want to or not, have a certain feeling about what you are portraying if you choose to portray a certain thing.
Yeah.
And they may not admit to it. We may not admit to it, but it's what goes into, what goes into it. It's why we all wear scrubs. Like we don't wear our personal preference to work because we don't want to be seen for that. I want patients to come in and see us for what we are providing for them.
Yeah.
Scenario 3, going through resumes, talk to a provider, happen to Google the provider, which again, I don't do, even though the past 5 minutes, it sounds like I do it all the time.
Yeah.
But I don't. This provider had their license revoked.
Yeah, that's something you're going to catch.
Kind of during COVID. It was since reinstated. There are repercussions if your license is revoked and then reinstated. There's a 5-year contract that you sign that has certain terms and conditions. After those 5 years, there are no more repercussions. So this provider that I had talked to, great on the phone first. Now HR is telling me, I don't know, getting this person credentialed now they have this smudge, this blip. But here's the thing, like everybody makes mistakes. They did their thing.
Yeah.
They paid their time. Now, what was the thing? Does it matter?
I don't think so.
Like, would I judge one way or another if it was, worked a 24-hour shift and took NyQuil in the car and fell asleep? I don't know.
Yeah, like that makes sense.
Right.
Sounds like a great Friday night.
Was this someone who had a bachelor party and then got called into work 2 days later and blood alcohol level is still kind of high because they had a really good bachelor party? I don't know. Does that make it more acceptable? I don't know.
I don't know.
But anyway, so this person now has this smudge. So like, it's a mistake. Okay. How long is it a mistake for? Like, is it acceptable that we forget after 5 years, 10 years, 15 years? Is it never forgiven?
Yeah.
Is this person always going to have this now follow them like a scarlet letter for the rest of their career?
I hate that for them.
I hate that for them.
Yeah. Like it, especially, you know, you've recognized it and done your time, like you said, so to speak.
But even like the whole
on.
DUI thing. What if they got a DUI at 17
in college
before they even went to college or PA school?
Yeah.
So can we judge a 17-year-old who now is a 35-year-old provider? No, but HR tells me I have to.
I hate that.
It sucks because it also leaves like
good
what's the redemption track? Like, can you ever come back from that?
Yeah.
You know? And do you always now have to explain yourself coming back from that?
Yeah.
And God forbid if those of us who haven't had anything that's like questionable, now I'm always going to be like
in fear of that.
Yeah, in fear of that.
Yeah. And I hate that. Like I do get that, like, yes, those things are going to follow you, but like, gosh, can't we all just be a little more forgiving and understanding of everybody's past? I don't know. But I also think that there's a difference between professional mistakes and personal mistakes and having to separate those two. Like, wouldn't you think it's a bigger deal, per se, to hire somebody who had made like a major medical error than had a DUI 10 years ago,
but that's
and
the
no
thing.
other criminal history since?
In North Carolina, the medical board decides when you get your license taken away, and then they decide when you get it back. So like, if that's the case, then punishment has been served.
Yeah.
So why are we then having any opinion?
Why is my say more than the medical board? Like, shouldn't they be the ones?
That's
to
why the
judge
medical
if it's
board
acceptable
exists.
or not? Yeah,
exactly.
Yeah, we're not
it's
the
like,
medical board.
Yeah, it's like people get arrested and then they're out in the wild. Now we fear them. I don't know.
The jail has said that you've done your time.
Yeah, jail says. Yeah.
I guess, you know, maybe that's not always. That's a little bit more gray area, but these are all gray area things.
They all gray.
Like,
it's a gray area.
It's very, very gray. This is not at all black and white.
But I think the question here, and I don't think I have the answer, is the mistake forgiven, or is it not forgiven? Sorry, is it forgiven but just never forgotten? Like, it's so sad to think about.
Yeah. Forgiven and never forgotten, I think, is more acceptable than never forgiven, meaning like you can never come back from it and have a job again. Or
so if this is a PA that we're talking to and they're listening and they're like, oh my God, this is me. Like, do you just uproot and go to another state? Like, do you have to? Or do you just address it? Do you have to have like a 5-minute spiel as to why, and this is who I was then, and this is why I'm not that person now, and here's my 4 letters of recommendation that show that?
Yeah.
Kind of, right?
Yeah.
I don't know.
I hate that. Like, I mean, everybody makes mistakes.
Yeah.
And everybody should be allowed to be who they are outside of work.
But I think that the take home,
live in my little happy
but the take home here is, are you a good provider?
Yeah.
Do you have a good character?
Yeah.
And outside of that, and there's like 10 deviations for the character part, but good character according to who, right? So are you a good provider? So does a good provider look at their mother-in-law's medical record because they just want to make sure everything was done okay? Mm-hmm. Technically, that's a violation.
I never understood that one. Yeah, I mean, I do, but like I don't.
Yeah.
Like, so, what's the problem?
We worked with the physician, not with the physician, but the physician was at the same facility that we were at. And the mother needed foot surgery. Mm-hmm. And this physician, you are not allowed to operate on your family members. So this physician booked the case under his partner. When the patient came back to the room, that physician came in and said, hey, my partner's not available. I'll do the case. And the hospital was like,
planning to.
It was totally planning on it. And the hospital was like, you can't do that. And he's like, well, they're under anesthesia and there is no provider, so I can. You know, like,
yeah, like, oh, now I've made it some.
I know, but like,
scenario,
how?
Yeah, I mean, I get that. Like, that's you know,
that's sneaky.
That's crossing the line.
Sneaky. Yeah.
Yeah. I mean, as far as like accessing charts and stuff, I mean.
But if I were to access my mother-in-law's chart, I don't know why I keep saying my mother-in-law, but here we are. If I were to access my mother-in-law's chart to see if she had an intramuscular Toradol injection versus dexamethasone,
I mean,
technically, also, like, why am I looking at my mother-in-law?
But like, what if they're asking you to, right? Is that a different thing? You know, what if my dad is like, hey, can you check and see like when the last time I got XYZ is like, what's the problem?
Yeah. But if you're reading the note,
that's
not
kosher.
That's not kosher. Yeah. But we don't, that's not offensive. Right. And like, let's say that, of, a provider, like I said, that like, you have a girlfriend and they're dating and they dated this provider. You know that this, that this provider they dated is kind of a douchebag. So now like, does that go in their background check?
No, but it's in the back of your mind.
It is in the back of your mind. But like, again, technically, are they a good provider?
Yeah.
Maybe they're not a good boyfriend.
Yeah.
But are they a good provider? And should you hold it against them if you know things that,
Yeah. But I mean, and part of this also comes down to like, it's a small world. So you got to be real careful about how you conduct yourself all the time, because you never know who's watching or how it might come back to bite you.
Yeah. So are we creating a culture of fear? I don't know. I'm kind of scared of this. I'm kind of scared
now.
here.
Like, do I pull up my Instagram and like start deleting? Like, oh my God.
No, I think you can learn from your mistakes, because guess what? It's inevitable. You're going to make mistakes. Yeah. Be vulnerable. Poof, I hate that advice. But
if you're too vulnerable,
I know, please, they'll get eaten alive. But no, be vulnerable in so much as if someone's asking you about that can't be something you're not expecting. Yeah, right?
I mean, you can't lie about it.
But we cannot create an environment where one mistake defines your career. We cannot.
Yeah, I think that's wrong. I think, does it work like that I'd be curious, like for physicians as well?
But what this will lead to though is younger people knowing this and how like, hard it is to navigate this world. Now you're running into a generation of people who are afraid to admit errors. Mm-hmm. Like I had someone who used to work for us that would always yes me and told me they did something. They didn't do it.
Yeah.
They were afraid of, I don't know, getting in trouble for something. But then again, now you're not admitting your errors, and let's say someone notices that they are not mentally stable.
Yeah.
You have to be clear that you need some help. Right.
Yeah.
So you can't have a culture of fear where now you're making mistakes, but then you can't also have a culture where you're judging people for needing to make mistakes. You know what I'm saying?
You have to be able to like, I feel like this constant dichotomy of like the need to be perfect. I don't know why I use the word dichotomy. That's all right. What I'm trying to explain is I think about the urgent care providers, having lived in that space for a while. You're hired with the expectation that you are going to be an independent thinker, an independent decision maker, and make and keep people happy. Mm. And for lack of better words, serve the customer and do what they want you to do. Keep things flowing and keep that business like doing well.
Yeah.
But you are also expected to read the minds of all of the physicians overseeing it and do exactly what they want to do. So I have encountered several instances where somebody has done something not necessarily wrong, like medically wrong, just different than what that other person would have done and been severely reprimanded for it.
Yeah.
And that sucks. Like the person didn't make a medical error. What they did was disagreed with what you would have done. And they may not even have known like what that person wanted to do. And like, is the correct response, I think, yes, for the provider. Because ultimately, like, yes, we can function independently, but are we independent providers? No, we work under the physician's licenses. So I would never intentionally go against what the physician wanted me to do if I knew they wanted me to do something different. But that comes down to them calmly addressing like, hey, I actually prefer if you do things this way instead of like blowing up.
Yeah.
Yeah. Like, gosh, people get scarlet lettered for some crazy things.
Yeah. Telling you. But in regards to those that, have had some mistake, and again, the DUI, the, I don't know, the offense, the hearsay, Friday night drunken, whatever. Was anyone harmed?
Yeah.
Was it intentional? Was it isolated, or this is a pattern? And to test their character, what happened afterwards? Did you accept responsibility? Did you learn from this?
Yeah.
Did you seek remediation? Did you demonstrate growth? Or do you continue to make excuses? That right there is going to determine whether that is a trustworthy person or not, because we're not hiring perfect people. We're hiring those that are trustworthy, and you can't have trustworthiness without mistakes. Like, yeah, it's what someone does after that determines what type of provider they're going to be.
Yeah.
Right.
I agree.
Yeah.
That was a good exit speech.
It was a good exit speech. Damn it. But I mean, we cannot have providers that are fearful of making mistakes, because it is a fine line. But if you are to get into this field, you have to understand what that comes with.
Yeah. You are representing something bigger than yourself.
You're not working at Target.
Yeah, you're not working at Target. It's somewhat of a, well, I shouldn't say somewhat, this is a privilege to work in this position, and in these roles, people depend on you and trust you, and you have to conduct yourself a certain way. I can't make the comparisons that I want to make right now because they're a little bit too politically charged, but
perfect.
I'll keep those to myself because that's not the space for this, remember? But yeah.
But it's interesting though, because we have done many, many, many episodes thus far that have been like, on the funnier side of stuff and whatever, but this is also really real too. Like, unfortunately, these are all like things that we deal with. So, hopefully that was educational.
Very educational, and
just like a lateral epicondylitis talk would be. Or a distal biceps tendon rupture talk would be.
Oh yeah, well, we'll
talk about that next week.
We'll do lateral epicondylitis and distal biceps. We'll do elbow pathology.
We should
do something. God, I hate when I say the word educational. It's all educational.
It's all educational.
We'll do something clinical based. I wanted to do soccer injuries too at some point.
Yes, World
like
Cup.
Some World Cup. Yeah,
Yes.
yeah. I asked one of our foot and ankle.
Do you see the tib-fib fracture?
Yes.
Oh God, that just it hurts my heart.
Yeah,
it was awesome,
painful to look at, but
it was.
Yeah. All right. Until next time.
All right. Bye. Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.